special three-part series, we're putting the problem under the microscope. There are many treatments available for serious hair loss, including surgical options like hair transplants. That may sound scary, but for one woman, it was the answer she'd been waiting for.
Standard operating procedure.
Marion Malloy is used to being in control. As the duty manager for an international terminal at Newark Airport, it's her job.
Had a gate hold this morning.
But Marion wasn't always so self-confident. Due to a condition called alopecia areata, Marion began losing her hair back in college.
I was on my own for the very first time, and, you know, I was learning about life and learning about, you know, my hair loss, and it just devastated me. So I started seeking out methods to improve my hairline. Initially, I went to a dermatologist who put me on a prescription of injections, actually. I would go in weekly, and he injected my head. And I got results, but I also started growing facial hairs, which wasn't something that I wanted. After that, I decided to start with Rogaine. And once again, I saw results, but Rogaine was something that I had to do every day for the rest of my life, and I just didn't want to be that dependent on a medication.
Marion continued to search for an acceptable treatment to her condition, even trying hair plugs, until she heard about Dr. Robert Bernstein's new method of follicular unit transplantation, or in layman's terms, a hair transplant.
I wasn't scared at all. I was desperate, you know, so that overrode everything.
Marion Malloy is here along with her dermatologist, Dr. Robert Bernstein, to help us look at some of the medical options that are available to women suffering from this affliction. Good morning to both of you.
Good morning.
Marion, thank you for speaking out about this very private problem. How has your life changed since getting a hair transplant?
Well, I just feel better about my appearance, and appearance is very important to me in my line of work. So I just feel a lot better, and I think I look better. My hairline looks better.
Boosting the self-confidence department?
Actually, yes.
And your friends and family see a difference in it?
Well, you know, my friends and family really didn't notice a difference before, and they thought I was crazy for harping on it the way that I did.
But if you see it, that's all that
it was all about me. It's not about my family and friends. It's about how I feel.
Right.
Yeah.
Dr. Bernstein, I want to go through all the options that are available for women, but what is the difference between female and male hair loss, option-wise, what we can do to treat it?
All right, well, the main difference medically is that women have hair loss often from hormonal changes, and it's due to an imbalance between progesterones and estrogens, and that equilibrium can be reestablished with medication. Often birth control pills can do that.
So that's one option.
One option. For the most common cause of hair loss, genetic hair loss, Minoxidil can be used for both men and women, but the most effective medication for men, Propecia, can't be used in women. And the reason is that it causes birth defects if taken during pregnancy. And postmenopausally, it doesn't seem to work.
Oh, okay. So talk to me about Minoxidil, also known as Rogaine.
Right.
Just as successful for women as in men?
It seems to be somewhere successful, but the success rate is not very good. And one of the problems with its use in women is you can get hair around increased hair around the hairline and on the forehead. So the usefulness is a little bit limited.
So is it promoting hair growth if it does work, the Rogaine, or is it just making your existing hair grow in thicker?
No,
I've heard both.
Yeah, it actually stimulates hair growth.
Okay, so you got to be really careful topically what you touch after you're rubbing it into your scalp.
Right.
Another option is topical cortisone and cortisone injections.
Right. Well, many people think that cortisone can be used for genetic hair loss, the common hair loss, and it really can't. It's really a good treatment for specific types of diseases, and the most common one is alopecia areata. In that condition, the body actually fights off its own hair follicles, and then the cortisone is used to suppress the immune system and actually allow the body to permit the hair to grow back.
Now, Marion tried these options that we're talking about. You weren't satisfied, so you had a hair transplant.
Yes.
Describe exactly what you did for Marion.
Right. Well, in the past, hair transplantation was not a good option for women because hair was transplanted in little clumps. With a follicular unit transplantation, we can now transplant hair exactly the way it grows, which is in little tiny bundles of 1 to 4 hairs. And what we did with Miriam is we took a strip from the back of her hair, and it was right from the back of the scalp where you can see it.
Where there's more hair.
Right, and take that strip and put it under a microscope and dissect out the individual follicular units, the hair exactly the way it grows in nature. And that hair is then put in needle poke incisions along the hairline. And because the grafts are so small, we can actually mimic the swirls and the change in hair direction exactly the way the hair grows in nature.
And it stays?
Yeah, it stays. We make a very snug fit between the graft and the needle poke incision. And so that it really holds on to the grafts well. In fact, the patients can shower the next morning.
The next morning. Yes. Marion, what was your experience like having this hair transplant? No problems since?
No problems, absolutely no problems.
Did insurance cover any of this?
No, absolutely not.
How costly is this?
The average procedure is about $7,000.
And it's one procedure and you're done?
Usually 1 to 2 procedures.
$7,000 a pop?
Yes.
Well, you found it was worth your money, is that right, Marion?
Absolutely, yes.
Dr. Bernstein, Marion Malloy, thank you for both coming on the show talking about this. And tomorrow we will wrap up our series on female hair loss with a look at